Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, I can say for me, I did not know much about dialysis until I met Susan Setti, and then she introduced me by taking me to the most gorgeous place. I never knew it would be a dialysis center. It's called United Dialysis. It's in Pompano Beach. And since that, I've become very interested in it because it is not something common unless you're having dialysis. So we have a nurse who is here, who's been with them, and we have a senior technician who will be able to tell us a lot of things because this is very technical. You know, we know that. So let's start off with you, JODI WAUGH-SANTOS, and then we also have Marcus Desir, and he is a senior technician. And so let's ask you, JODI. You are a nurse,
yes,
and you decided to get into this very specialized medical
specialty.
Specialty, right? Because it only affects certain people who have are not able to urinate the way everyone else does, right?
Yes. Well, basically, we know a lot of people who have diabetes or hypertension, and it can be both or anyone you know that's having really bad issues with this disorder. So what happened is the hypertension destroys the kidneys, so does the diabetes, and then here you go, the doctor is telling you that your kidneys are not functioning correctly and that you're going to be on dialysis. You will no longer be able to urinate the way you do, and you can't clean your body because that's what your kidneys does, is it removes all the toxins from your body. So this is something that you will have to deal with for the rest of your life until you either get a transplant or it's an acute phase that just so happened to occur by chance.
So for people who, let me say 50 years ago, was there dialysis?
It's fairly new.
Yes.
It's extended lives for up to 10 years. Because before, 50 years ago, you have dialysis and then shortly after that, you're gone.
Well, maybe this is a good question then to ask Marcus. So, Marcus, what, you've been doing this for how long?
It's about 29 years.
29 years. Well, give us some history about this. How does someone know they have to have it? Does a doctor tell them that, or they're having other kind of problems?
Practically, a doctor has to diagnose, that has to do the diagnosis, and then once they tell you that your kidneys stop working, at that time you know that you have one alternative, which is going to dialysis. And the doctor would prep that patient, by doing what needs to be done, and eventually, they would start dialysis.
Okay, so now since you're the senior technical guy, someone comes in, they've never had dialysis. What do you say to them?
Well, it's funny because I have a lot of people that come, for the first time, getting to get dialysis treatment. And you could see the fear, the anxiety, of it. And then, my job is to reassure that person that, it's like, let's just get to it. And then once you're in it, and you'll see that, it's not that big of a deal, But, until the patient starts, he or she will not really see what's going on. I will sit with them, take the time, to explain to them, talk to them. And then, of course, it is the dietitian and the social worker, the doctor, the nurse, everybody together, talk to that patient and, to reassure them that, life would keep, will keep going, as long as, he or she does what the staff tells him or her to do.
Well, Marcus, I have to tell you that when Susan Setti took me there the first time, I did not know that it could possibly be for dialysis. It was so beautiful, it was so modern and contemporary, and I actually had never been in a dialysis center, so I thought they're all like that, but I've been told they're not.
Oh, no.
And so you, as a nurse, let's just go and have you now get into this conversation. So someone is, I guess, you're the nurse there, so you have to make sure that all the paperwork, everything is right, and then you have to stay on top of this, I have to assume.
Yes, I have to make sure that my wonderful staff make sure that my patients feel at home. Our goal at this facility, which we've been set aside from the rest so far, is that we have a nice family atmosphere, because we spend a big portion of their lives throughout the day to get them healthy. So we're there, we laugh, we joke, and we let them feel at home that this is not the end. We are a part of your family. So when you leave, life still goes on, and we'll still be here, and we'll be your extended family. We've had patients leave and say, I think about you guys when I leave here. And I'm like, oh gosh, why? But, they love coming to dialysis because we make them feel comfortable.
So tell me what dialysis consists of. So someone comes in, and what actually happens to them?
A patient will come in. What we'll do is we'll assess them. We'll weigh them. They get on a scale. We see what their basic weight is. And then we'll take them over to their chair, and we'll prep them for their cannulation, or insertion. And we'll make sure that everything is nice and clean. We connect them to the machine, and then we clean their blood. So, you want to add anything else, Marcus?
What was the question again?
No,
that's
that's really very good that you're caring about them. It's, you go to a lot of hospitals, you go to a lot of rehab centers, and it's just, it's 1, 2, 3. They don't really maybe know you. They don't ask who you are. So it's a very different situation. It sounds like you don't want them just to come in and then leave. You want to know who they are, their grandchildren, and then when they're coming back. And they can bring anyone, can't they?
They can. We have a couple patients that have, we have a husband and wife who are amazing. A
husband and wife both on dialysis?
No, actually just the wife. But the husband is there right by her side after we cannulate, because we don't like to have them when we're actually putting the needles in the arm, because we have to keep it sterile and clean. But then afterwards, we'll give him a gown, and he'll be able to sit with her as she goes through the treatment. And he appreciates that,
Sure.
And, if anything has happened, then we'll have him step aside, because, for patient privacy and so forth. But it's a very comfortable atmosphere.
I saw people watching television.
Oh, yeah.
Saw them reading books.
Yeah.
Well, because when it's happening, are they feeling anything?
No. I mean, it's like your body clean. You don't know when your body's cleaning. So we're technically doing that, but we're doing it outside the body. So, I mean, the most they'll feel is they'll get a little thirsty or cold or, or a few cramping, which is normal because the body is shifting fluids. But they can go through the whole treatment. Some people sleep, some people read, some people conversate, So it's like a mini vacation if everything moves smoothly.
Okay, and how often does this have to happen, Marcus? How often do you want to see those people?
That's 3 times a week.
3 times a week, and how long does it usually last?
It all depends, on the condition, because when the patient has his or her kidney fail, it would not be, sometimes it's at 100%, and sometimes it's like 20%, because you have patients that are on dialysis, and then they still urinate.
Oh, really?
Yeah, they still urinate. It's just like, the kidneys, they're like filters, they filter the blood. And then if, like, the filtration is done at only 18%, at that time, the patient still urinate, but, the toxin remains in the blood. At that time, they would not prescribe 3.5 or 4 hours or 4.5 hours for that patient. It would be like, some people would be 2.5 hours, 3 hours. So it all depends on the condition of that patient, That's how the doctor would prescribe the time.
I see. And it looks like you have a new doctor who is Dr. Samir Diaz. Diab. And he's considered one of the top nephrologists. And his commitment seems pretty good. So he comes in, does he make sure that everything's working right?
Oh, yeah.
Oh, yes.
And they love him because he's very jovial, so he doesn't make you feel like, oh, gosh, he's just here to see me and go. He laughs with them. He talks with them. And he's very knowledgeable. So he actually sits down and explains to them what is going on.
And you said something about acute dialysis. So are you saying that sometimes because of a particular acute situation,
Yes.
someone could be having dialysis but then not?
And they'll get off. We've actually had 3 patients that
Yes.
happened. Yeah, and we celebrate. They come
course.
in and we clean their blood, and then we do labs. We make sure we confirm that they're back to their regular numbers, and then they get to go home. And it's just an amazing feeling.
Yeah, so people don't know that. I know some people, I think you said that they could be on it for 10 years?
Up to, the average is dialysis extends your life up to 10 years, but I've heard it's been longer, and it depends on the person and how dedicated you are to stick to the regimen that they give.
Right, the right
So-
food,
right,
exercise,
exactly.
everything, right?
I had a couple of patients, one had dialysis for 30-something years. And then the last one, just passed. He had it for like 28.
Well, that's very good news, but they did what
They did what they needed
what
to be
Jody
done.
said,
To
right?
take care of themselves.
Well, that's extraordinary. So, and maybe things have changed nowadays. Maybe
Technology,
the early technology wasn't as good as it is
Right.
today.
Yes.
But I noticed actually, Susan took me in the back where you have the special water,
Water,
you have
yeah.
all sorts of things that
Yes.
are no one would really understand this. So hospitals, do they do this, or they send people? They send people to dialysis centers like yours.
The dialysis center is usually for long term. This is when they're being released from the hospital and now they're getting back to life. But the hospitals do provide this service because, of course,
it's an
that's where it
emergency.
happens. Right. Usually that's where they end up first. It's like, oh my gosh, I can't pee. Something is wrong. Let me go to the hospital. And then they'll run labs. And then they'll be like, well, your kidneys aren't working very well. Let's help you to start cleaning your blood. So that's where they start off with the catheter. And then they'll find out how far and, what's next for them to do.
So you call it cleaning the blood.
Yes, cleaning the blood.
And that's and so what's happened? There are toxins in the blood. Is that what's required? Is that why?
Yeah, it's usually, how is it? We eat, we breathe. Everything we take in our system has to be processed. So, and the kidneys is the one to do it. So, hence urine. Urine is just waste, After the blood has been cleaned by our natural kidneys, which are little tubes, little filters that catches, say you go fishing, and you scoop up certain sediments in the net. The net is technically the filter, and we're catching that. So the blood is small enough to pass through those filters, but then the toxins is what passes through the other side of that filter, and then that's where you get the urine from.
And so if someone doesn't have this dialysis, they could actually die, couldn't
Yes.
they?
Yes. Toxicity, all that toxic stuff building up in the blood, you get confused, everything stop functioning.
So when you say that, I was just thinking about people who talk about a family member maybe has, they think they have Alzheimer's, but maybe they don't. Maybe they just have dementia caused by something like this because no one caught it. I don't know, but it just sounds to me that it's pretty serious in your body.
No, there would be other signs and
Right.
symptoms, to tell you that you need dialysis.
Dialysis, yeah. Because even a simple UTI can cause confusion in the elderly.
That's true.
So it not necessarily has to, the mental aspect would be acute in the dialysis phase, whereas dementia would be long-term. It's a long-term progression. So with dialysis, if you have confusion, then something is happening right away, So then you have to look into it, like, why is this person being confused at this moment when they shouldn't be?
Mm-hmm. So this is really very, very specialized medical problem, and I wonder, maybe this, Marcus, is this a very high percentage of people going through dialysis in the United States? I mean, is this minimal or what?
These days, yes.
Yes.
These days, yes. A lot of people are going to dialysis.
I was thinking of people on drugs and all sorts of things which could really cause this.
That might cause the acute part. Dialysis is up in the top 10. I mean, the end portion, it's up there with cancer and all that.
Really?
A lot of people don't realize that, and it's very, very common because it has to do with high blood pressure and diabetes.
Is that
and
right?
they're in the top 10. So if it's not one or the other, and sometimes both, then the end product of that is if you don't take care of your diabetes, if you don't take care of your hypertension, then the next and worst step is your kidneys will fail, because all that sugar and all that pressure from the blood pressure is damaging the filters, and now they're not working properly.
People don't really know that.
They don't know that.
I mean, you're really adding another dimension to something that we just figured was something else, something really bad. Yeah. But okay, so let's go over just what we've been talking about, and I want to just talk about this beautiful center. It's located in Pompano Beach, and it's over at 1311 East Atlantic Avenue in Pompano. The website is pompanodialysis.com. The phone number, everybody knows that this is talk radio, but it's pencil talk radio, because we always want you to get a pencil out and write this down. 754-307-1536. Again, 754-307-1536. And it's called United Dialysis Center. There's plenty of parking. I know that because I've been there. They have a flat screen smart television so you can enjoy yourself, watch all your soaps. Private treatment rooms available, and I don't know why we have private, because most of it's all in a big open thing. Why do you want private?
Well, it depends on basically the owner. He structured it that way where he wanted to also provide for a doctor so he can also see their individual patients.
Yeah, that's very smart. I understand. All right. And the chairs are ergonomically designed chairs. Let's talk about the chairs, Marcus. I know you're anxious to do that.
That's top of the line. They're like bed. You want to sleep. We can put it all the way down. If you sleep, that's top of the line chairs.
So when you all get tired and no one's sitting in, you can sit in it yourself, right?
Oh,
yes.
Well, depending on the time, we pull up a chair and we sit beside our patients and we ask what's going on, and it's really comfortable.
Yes.
That's right.
And we want the listeners to know that all shifts are open. Mm-hmm. We do it by shift. We have a first, a second, and a third shift.
Okay, what are those hours?
We start as early as 4:30 in the morning.
Really?
Yes.
That's for people who work and have to get out.
Right, exactly.
Mm-hmm.
Okay. And talk about what's the next one.
The next one starts around 8:30, and then the last shift is about 11 o'clock.
Okay. And then we have, then do you have ways for people to be driven there? Do they have to get their own transportation?
What we do is we assist in the point where we try to apply. We see how their insurance work, and we try to get with different programs that provide transportation. Right. In the meantime, though, we do have a service that, say something should happen, then we'll be there to pick them up or take them back and forth.
Okay.
So, say their ride's not, they can't get a ride today, we have a van that will come out and get them.
And they shouldn't do this themselves after this? Can they drive themselves home and come back?
We have functioning, yes.
Because I knew someone who did this, and I think he drove himself.
Yes.
Yeah. So that's fine. And then I know you give them something to eat afterwards, don't you?
We give them snacks. We give them snacks, and they love coffee, and
something to be. Yeah. So it's not a problem to have food while this is happening.
We don't recommend it, but some people do need something, so we give them a little bit just to get them going.
From their blood sugar not going down.
Exactly.
Okay, so let's just go over this again. It's called the United Dialysis Center, and it's located at 1311 East Atlantic Boulevard in Pompano Beach. It's really very close. It's on Atlantic Boulevard, but it's very close to Federal Highway. You won't miss it. It's beautiful. Now, let's talk about the Mary Water Treatment System. Who would like to talk about that?
That would be Marcus.
Okay, talk about that. What makes that different?
That is, we have like a lot of water that is going, processing, the the treatment. We use a lot of water. So that is, there is that company, I don't remember the name of the company, that comes, they the one that did the installation of the water system. Yeah, built the system. Now, with that much water, coming from the city, every day we have to go through the processing of it. And then, you have to do the testing of the water, to make sure that, chlorine and chloramine, is removed from it, before it goes into the patient. It doesn't go through the patient, but that's water that processes, the filters and everything.
So it must be pure. That's what you're saying.
Pure.
So therefore,
Exactly.
that having this Amera water treatment system has been, so nothing goes wrong. That's what I'm getting the feeling.
Yeah.
I'm getting the feeling that nothing goes wrong there at the United Dialysis. And I don't know if other places may, but first of all, this is brand new. So the owner made sure that everything was top of the line, very innovative, compared to, and I know there are a lot of other places who are, and I've seen some of the buildings as you drive by, and I haven't been in there, but that's right, and you wonder what's going on. And of course they're licensed, so I'm sure they have to do the very best they can, but there's nothing like being in a bright, airy place with smiling folks like you, right?
Yep.
And so if someone wants information, let's say they're now going to a dialysis center, but they want to switch and go to you.
Yes.
How would they do that? By just telling their doctor? How do they get to do that?
Well, what we do is they'll come in, they'll let us know when they want to leave, and we have a release of information form that's being signed. Once they've signed that and given us the go-ahead, we'll go ahead and fax it over to the next facility, giving them a heads up and let them know that this patient wants to be with us and we are willing and able to take their doctors if they like to come. All doctors are accepted, so they can always come and see their patients. So the patient, if they're worried about leaving their doctor behind, they can always come and visit.
I'm glad you brought that up because I want to say something that many times, a lot of professions, there are doctors, there are all sorts of people who recommend people, and they've been doing it. But because United Dialysis is new, they may not have been recommended because they weren't there.
Right.
But if you go to see this beautiful facility, you'll want to go there.
Oh, yeah.
And nobody can keep you from going there. So your doctor can't say, no, you can't go there.
Right.
Let's get that straight. If you like it, you can go there. You just have to deal with you as the nurse or the doctor there. Doctor, and I'll get his name again.
Yeah.
Yes, Dr. Diab. There's a lot of names.
Yeah.
Seymour Diab, Aga. So we just say Dr. Diab?
Diab,
Okay.
yes.
So Dr. Diab, all he has to know is that you want to change, and he can help get that paperwork done, right?
Yes. We'll handle the paperwork, and we'll look into the insurances, see what the availability are, see what the coverages are. Once they've been approved with the insurance, then they're free to come.
Well, and you're taking all the insurance, I have to gather, most of it.
Well, we're taking we have a list that we don't have it right now.
It's okay.
Yeah.
So if people just, I guess the first step is to make an appearance there.
Make an appearance.
And go and see.
That's right.
Go and see you, of course, or whomever is there, and then you can get started. So let me give you a phone number again. It's 754-307-1536. And the website is pompanodialysis.com. And the other thing I think to remember is that you may have a friend or someone who's on dialysis, and you can tell them about this just because you're listening and you're not on dialysis, right? You never know. Hopefully you're not going to have to be on it. But everyone seems to have a friend or knows someone who's on dialysis. You ought to ask them, where do you go? And would you like to go to this place that's like out on the moon? I mean, it is really beautiful. And the people there are, you're so proud of it. And I think you add a great luster to this. So I'm glad that you're doing this. The other thing is there's plenty of parking. And that's very important. They park around in the back, right? Because I've...
we have in the front and around the back.
Right, because you're on Atlantic Boulevard anyway. And then you can just park in the back. And actually, you said that, what's the longest time someone would be there? Was it 4 hours?
Yes. Usually it's an average of 4 hours for the long term.
Yeah, it all depends.
Yeah, let's say it's the one the most. They're not there longer than 4 hours, right?
No.
And then you also said that you start so early, and that would be a great thing because then it doesn't interfere with anything.
Right.
And do you have to rest when you go home? Are you going to sleep? Are you going to be tired? What are you going to do?
Sleep.
Yeah, but you've been sleeping there.
Oh, no, as far as the patient?
Yes, that's what I mean.
They would have to, well, it depends on the patient. We have patients that continue their jobs, and then we have patients who they rest for the rest of the day.
Okay, but somebody who's in good condition, other than that
They get going.
they go and they don't feel anything. They just go and then sleep.
Yes.
And so they take. So if it's 3 times a week, it's every other day in a
Yes.
sense, and then a long weekend.
Mm-hmm.
Right. Okay. Well, I think these are all rules of the game,
Yes.
in a sense. You know, they come in and you sit them down, and you tell them what it is with a smile on your face, and so that they're not afraid, and they understand. And of course, you can always get on the internet and look up dialysis and learn about it. But it's much better to do it, I think, with people who have been experienced and people like yourself. So it makes a very good thing. Well, one way that, of course, I found you was through Susan Setti, and she is the most wonderful woman. And so if she loves this, I'm sure that everybody, would really appreciate it. So the one thing we're looking for are doctors who want to send their patients to an excellent dialysis center, and I highly recommend this. So I'm so glad that all of you were here today.
Thank you.
And we look forward to, I'm going to come over there one day when you're there, and you can give me some of those cookies or things that you
Oh, yeah.
that you give, but thank you for being here.
Thank you for allowing me to visit.
Yeah?